Brigadier General Deidre Tahan. Welcome to our 7th episode of BAMC Med Talk. Today's episode will focus on topics important to women's health. We have routine screening guidelines, birth control considerations, pelvic health, and pregnancy, to name just a few. Fortunately, we have several world-class experts with us today to explain the latest women's health guidelines and recommendations. So can you tell me the beauty of having amazing nurse midwives helping our patients here at BAMC?
The role of the military midwife is to provide gynecological care as well as prenatal care. We start off care during adolescence and go through menopause, beyond menopause. We provide care for screening, such as Pap screening for cervical cancer, breast exams, pregnancy care. We are able to take care of women from the time they find out they're pregnant, throughout their entire pregnancy, and then our care does not just stop here in the clinic. We go up to labor and delivery, and we're their delivery team as well.
That's amazing. You have a great program called Beautiful Beginnings. Can you tell us a little bit more about that?
We have 2 care models for pregnant patients here at BAMC. The first is the traditional care model. This consists of the patient coming in and having about 20 minutes with the provider. This is an individual form. The second model is called Beautiful Beginnings. This is the group model. This consists of about 10 patients who will deliver within 4 weeks of each other. This is a great way for the community to invest in itself. We have patients who are first-time moms, patients who are a mom for the 6th time, partners can come, moms, grandparents, anyone can come. It's really a great model.
I really love Beautiful Beginnings. The feedback I've heard from patients is that it really allows them to create a community with other moms going through the same thing, so they can actually reach out when they are having problems and they know they have a support system.
As much as they invest in us, we get to invest in them.
Tell me a little bit more about military nurse midwives.
Well, our military nurse midwives can provide care in deployment settings. This involves giving care at refugee camps. This involves going to humanitarian efforts, as well as caring for our service members abroad.
That's just wonderful. Thank you.
Thank you, ma'am.
We are now in the OBGYN Clinic. Can you tell me a little bit about the services you have available for the women we serve?
Yes, here at BAMC, we are a tertiary care center. We offer the full scope of women's health care. We have everything from GYN oncologists for GYN cancer care, urogynecologists for pelvic floor health. We have reproductive endocrinology and infertility services, which include the full scope of in vitro fertilization. We have high-risk obstetrics with a level 3 NICU to take care of high-risk pregnant women. And we take care of women that come from all over the world, our military service women and their dependents.
That's pretty impressive. That's a lot of services here. Our women that come here know that they're in good hands. Can you tell me more about the guidelines and what people should know about women's health?
So we usually start screening for cervical cancer with Pap smear screening at about age 21, and that's every 3 years up until about the age of 30. And then we add in that HPV test. If you haven't gotten the HPV vaccine, we offer it here in our clinic up until age 45. That's when it's recommended. And the other big important thing for women's health is contraception. If you're not actively trying to get pregnant, we do recommend you're on some type of contraception. And you can access contraceptive services throughout JBSA. You can make an appointment here at the OBGYN clinic, and you can access several of our walk-in contraception clinics. You may have seen the flyers we have, the PINK clinic. It stands for Patients in Need of Contraception, and you can walk in and get walk-in contraceptive services, pretty much the full scope to include the long-acting reversible contraceptives, such as IUDs and the implants.
That's pretty amazing. Our PINK clinic really makes it easy for every single woman in this area to get the services they need.
It sure is. And starting May 1st, we are going to be offering at the Moreno Pharmacy. The pharmacists themselves can prescribe birth control pills, patches, or rings without even needing to see a provider.
Thank you for all that you do to help allow our active duty service women to get the health care they need, but also to be able to defend our nation.
Thank you.
BAMC is so lucky to have pelvic floor physical therapy. Can you tell me what is a pelvic floor physical therapist?
Sure. So pelvic floor physical therapy is a specialized kind of physical therapy. So this pelvic floor therapist, they are trained to focus on the pelvic floor issues, and they are more like bladder and bowel incontinence, prolapse, pain with the intercourse. And not only that, this pelvic floor muscles, they are the dynamic stabilizers of the spine. So they do take part when we do different activities. They are part of core muscles.
Yes, they say pelvic floor is the floor of the core, right? Which can help prevent low back pain and treat low back pain. But like you said, it's so important for treating incontinence and really post-pregnancy challenges. Can you tell me a little bit more about the patients that would want to come here and see your services?
Yes, so first of all, so many of our patients, they are not aware of, because incontinence, like 50% female, and with the age it increases to 70-75%. Same with the fecal incontinence. All those things are like a taboo subject, so they don't talk and they just take it for granted that I have babies, so this is, but there is help available. So when it comes to women's health, pregnant patient, postpartum patients and postmenopausal are at more risk.
So many of our patients don't feel comfortable talking about this, so they don't even know the services exist. But when they come in, the evidence suggests that this is an incredibly effective treatment to giving women back their lives after they've had something like incontinence or pain with intercourse, or really any of those issues that have kept them from getting back to full.
I just want our patients to know that the help is available.
I think it's important for us to know there's muscles everywhere in our body, to include our pelvic floor, and we can train and rehab them just like we can train any other muscle. Yes. Thank you for all that you do for the women that come here for their health care. We really appreciate it.
Thank you.
Welcome to BAMC Labor and Delivery. What makes BAMC Labor and Delivery so special?
Well, ma'am, I think one of the important things about our labor and delivery unit is the excellent team of physicians, midwives, and nurses that we have here taking care of our patients. One of the things that we try to do with all of our patients is provide immediate skin-to-skin contact for baby and mom immediately after birth, whenever that's possible.
I bet families love coming here because the space is absolutely amazing to help a brand new family start their path together.
Yes, I think we have a nice facility here. There's plenty of room here in the room for mom and her support person, and if they choose to bring a doula, doulas are also welcome here.
Can you tell me a little bit more about the childbirth class?
Yes, so the labor and delivery staff offers 2 free childbirth classes each month that patients can enroll for, and they enroll for those in the regular OBGYN clinic.
I bet for some of our new moms, lactation is challenging. Can you tell us what you guys have to support new moms in that space?
All of our patients who desire breastfeeding have access to lactation consultant during their inpatient stay, and then those women who are continuing to have problems have access to outpatient lactation consultants here at BAMC also.
That's wonderful. I just had a friend that just delivered here, and they just had the most amazing experience and really raved about your amazing staff.
Well, thank you. I think we've got a great staff here, and I think we provide great care for our patients.
Welcome to our mammography clinic. Can you tell me why mammography is so important?
Well, mammography is stopping breast cancers early. So we want our patients to get their screenings on time, starting at the age of 40. We catch these cancers early and we nip things in the bud. The surgeries are less invasive and we have less occurrence of invasion to other parts of the body.
And remind me again, what age should people start getting their annual mammography?
Okay. All of our patients should be getting their screenings at the age of 40. There are some exceptions though. Some patients who have family histories, have mothers or sisters who have gotten breast cancer early on in life. Say for instance, they got cancer at 40. We want those patients to start their screenings at 30.
Wonderful.
So they have an early start.
And our real goal is to be there for them so we can catch it early.
Yes.
And when they want to make their appointment, what do they do to make an appointment to come here?
Okay, well, there's a couple of options. First of all, patients do not need to see their providers before requesting a screening mammography. As long as they are having no issues, they can call the radiology line, which is 292 X-ray, 292-9729.
Patients without a referral can just call the X-ray line and just come here directly.
Directly.
Because we really do want to break down any barriers that would keep people from coming and getting their annual screening.
Yes.
Well, thank you for all that you do for the women that we serve here at Team BAMC. It's greatly appreciated.
You're very welcome. Thank you.
I'd like to thank all of our experts for taking time to highlight the importance of women's health and talk about the services available here at BAMC and within the military health system. I'm incredibly proud of all of our teammates helping to ensure our health and wellness. Thank you for watching the latest episode of BAMC Med Talk. Stay tuned for our next episode, which will be on men's health.